Hey, it's Brad. So, I mentioned addiction some before, uh, generally in the context of the neurology of it just being stuck in a value loop. But as far as socially and for treatment and such, I like the view of addiction as an injury rather than a disease or anything else. Because some injuries are minor and some are pretty severe, and some are debilitating and very difficult to heal. And some are, caused from a person's profession or hobby and almost par for the course until a better way is found. And in that context, I'm talking things like, the classic literature authors and things like that, and how so many of them were opium or whatever it was of their given day. I'm obviously not saying you should go out and try opium. It's probably a horrible idea and definitely not something I'd say on YouTube. But either way, as an injury, some injuries stick with you forever. And sometimes you get, maimed and unable to do certain things thereafter. And it still maps all of the, disease view things and these other views, but viewing it as an injury, those are designed to heal if you're treating them correctly. Almost all the research I've seen, especially, the Scandinavian stuff, it's really interesting about when they just solve the emotional crises facing a culture, magically their bad drug use goes away. But a lot of times the criminalization is more of the problem than any contribution towards a solution, and there are so many other factors to establishment and maintenance of that sort of system that's way longer than any 10-minute discussion. But as far as addressing and healing addiction, the best wisdom seems to be that they should fail and keep trying. So, there's a common concept in software development of failing quickly, fail faster. You want to find new ways to fail. That old Edison quote or whatever it is about how before he found a way to make a light bulb, he found 1,000 ways not to make one instead of 1,000 failures. So failing faster in the context of rehab, that's viewed as just backsliding, and that's obviously negative. You don't want to go to rehab and then say, okay, now here, use a little bit of your addiction and let's see where it goes. That's kind of what they do, especially in criminal context. But again, whole other discussion. So I think that something like fasting should be involved in more rehabs. I'm sure it is in some, but I haven't really heard of it before used there. But, like just one day a week, have the participants fast, while they're on site, and then continue that in their home life. And that's the sort of thing where it's just disruptive enough to remind them that they're not just changing context back to home, everything's back to normal. Because that seems to be where it's most detrimental. Even the people that want to make the change and willing and able and can do so in the context of a secure environment, when they go back home, everything just goes back home. Everything just returns. Everything's as it was, and then they just lose all of it and just immediate backsliding, especially if they have no sort of security net encouraging them. But if it's fasting, well, firstly, that's going to be a lot easier if there's any sort of a stigma to their rehab and addiction. It's going to be a lot easier for them to say, to get in the habit of owning up to doing something that's only socially uncomfortable. And a lot of people do fast for religious or health or whatever reasons, so that it's not something that's objectively stigmatized. It's just in a lot of circles, people aren't really familiar with it, so it's going to be weird getting the hang of it. But that gives them something much easier to say than I'm in recovery. Anyway, and that's an easy thing to accidentally fail on, and then catch yourself, perhaps have your support network catch you, and then recover instead of a full backslide, which would just be hugely destructive. Anyway, the problem is I think most people nowadays are addicted to belief and addicted to outrage, despite not really investigating their own understandings of their own beliefs. They want that feeling of indignance and hedonistic pleasure almost. It's kind of masturbatory. And it's just, their moment space has to get down to just immediate. They can't think on larger than a moment scale, because then their brain comes into conflict with itself. And there's no pleasure in a conflicted mind, not in that moment. At best, it's curiosity about options. Anyway, I myself just am addicted to logos, intellectual conversation and pursuit, rational, of objective truth and all these things. And I mean, not ashamed of that at all.